Perfect. Okay, so Debbie, welcome tonight to Human Services hearing. I'm just going to give you a quick rundown of how we're going to do this, and then I will give you a chance to introduce yourself, and then we will get started. So, as you know, these are hearings that we do with all our agencies. As it is a public hearing, it is being recorded. These are board members that are reviewing your application. I'm gonna give them and myself 15 minutes to do questions and answers. Doesn't mean we're gonna have to use the 15 minutes. And if there's a question that you can't answer, then we right now you can email us and answer later. At the end of the 15 minutes, I guarantee that I'm going to give you 5 minutes. Again, you don't have to use them all, but I'll give you 5 minutes to say whatever you want to say. Okay. So why don't you go ahead and introduce yourself, and then we will start the 15-minute counter. We'll introduce ourselves, and then we'll start the 15-minute counter.
Okay. Thanks, Eliberto. I am the very nervous executive director of A Way Forward. Do you want me to tell you about A Way Forward?
No, that's part of the conversation. No worries. All right.
All
so
right.
Why don't I let the board introduce themselves? I'll start with Jeffrey.
Oh, I can't hear you.
Yeah, sorry about that. I wasn't quite ready for that. Hi, I'm Jeffrey Boring. I'm one of the new advisory board members. I think I've been on the board now for like 9 months. This is literally my very first application review. So lucky you.
Oh, I'm honored. Hi, Jeffrey.
I can go next. I'm Kim. I'm a board member as well, and I think this is my 4th year on the board. I'm starting to lose count, but it's very nice to meet you.
Cool. Hi, Kim. Nice to meet you.
Hi, I'm Martha Wilson. I'm on my first year of the board. This is my second round of the reviews. I'm a therapist and work with parents who have open child welfare cases. And I'm excited to hear what you've got for us.
Hi, Martha. It's nice to meet you. Okay, where do I start?
Well, you don't have to worry about that because it's on the board to ask the questions first. So, is there any questions from the board? If not, I can go first. I always have questions. So, Debbie, just and also I'm also trying to help our applicants understand the process a little bit. So the board and I, and this year we've added other staff to review. We review your application, but we look for different things. Where the board is looking at your program, and I'm sure there'll be questions about A Way Forward's recovery programs here in a second. I look at your agency level questions, right? So I look at how you are, what you answer at that agency level questions, and I'm looking at the business model, looking at how you're doing as a nonprofit. And one of the things that I look at is how is the organization preparing for future to be more sustainable? So what kind of strategic goals that have you and the board thought about or looked at as far as sustainability? You've started out really grassroots, you're growing, you're expanding, but how are you going to keep that sustainable?
I think that we've done an excellent job with the sustainability. Right now, our financials, comparing actual numbers to the budget numbers, we've achieved 92% of our budgeted revenue, and we're only at 54% of our budgeted expenses. So we're really careful with our money. We've dramatically increased staff to accommodate the tremendous growth that we've seen. So we've been able to hire new people to really establish ourselves in the community and establish ourselves as a solid agency.
And talk to me about the diversity of funding. Where is the majority? Like, how diverse is your funding? How are you doing on fundraising and donations, as well as other, grants and stuff like that? Is that pretty diverse? Are you pretty foundation heavy? What does it look like?
Our primary donor since the beginning has been the Colorado Health Foundation. We also receive funding from the Daniels Fund. We get a lot from private donors. We've gotten 17,000 from the United Church of Christ here in Longmont. That's on 9th and Francis. So different things like that. Last year, we got our first state grant, and that was the Department of Local Affairs. That's 75,000. So we're pretty diverse, and then we supplement that with fundraisers. Each fundraiser that we've done has brought in revenue from between 8,000 to 15,000. So that's sort of our model.
Awesome. One comment, and then I'll ask one question to see if the board has anybody. But so one comment I want to make. I really appreciated seeing how diverse your board is. That's good. So I want to commend you on that. You've been working on that, and that's super great to see. Then I'm also going to ask a question that my boss, the Human Services Director, Christina Pacheco, has asked every agency, because it's just a reality that we're facing. As you know, this is a competitive grant process. You've applied in the past, right?
Right.
This year, what we're seeing, and we've seen the last couple of years, is just the growing need. While our resources are growing, they're not keeping up nearly as much as we would like with the demand for grants and need for grants from local nonprofits. So can you tell us, what kind of impact it would have if your application was either partially funded or not funded at all in the organization?
Well, I would cry, Alberto, but I'm sure that we would find other funding sources. Um, uh, we've really established ourselves as an important nonprofit, I feel. You can see that in the number of clients that we serve. This is our 4th year of operations. Year 1, we had about 2,500 client contacts. Year 2, 5,500. Year 3, over 11,000 client contacts. We've already reached that this year. So it keeps growing. We really serve a purpose in the community. We are open 7 days a week. I know I'm in recovery, just full disclosure. I know my alcoholism never took a day off, and I really admire people when they have the courage to ask for help. I think it's important that somebody is there for them. We are open 7 days a week, 365 days a year, to be available for people to come and get help when they're ready to ask for help. So we're really on the front lines. We really fill a gap in the community.
Awesome. Any questions from the board at this point?
Just a real quick comment. I want to commend you on how rapidly your organization has grown. 4 years is not a long time when it comes to creating and building a nonprofit organization. And we, as advisory board members, we review a lot of applications. And so I think I have 28 applications I have to review. So I don't remember all the details of every one. But one of the notes I made is that you offer services in 4 different languages. And I just wanted to give you a chance to expound upon that. Is that true? And how does that enable you to serve a wider sector of the community?
2 of the languages don't really help at all, but I do speak fluent German and Russian. I spent a large part of my career working abroad, working in those countries. When I worked in Russia, I managed a $95 million line of credit for the World Bank. So I'm really comfortable in those languages. We've got material that I could help anybody in those languages. the most important language, of course, in Longmont is Spanish. And we have had Spanish language capacity since we opened in 2021. Right now, we have a wonderful recovery coach who originally came to this country when she was 13 years old. She also happens to be a veteran. And she has just, since she has been on board, just gone gangbusters at a grassroots level of creating contacts in the community, working with people. She's very much involved with the Latino Chamber of Commerce. She just this past month, as we were getting ready for to table at the Y Fiesta event, Lulu went to the Dulceria bonbon store on Main Street and met the owner, who happens to be the vice president of the Latino Chamber of Commerce. And at Dia de los Muertos last weekend, we shared a table with the candy store, and she's already bringing clients to us. That's the kind of grassroots level that we operate on.
Thank you.
You look like you're thinking, Martha.
I was trying to check something before I asked and sounded dumb. But I saw that there was like just a larger ask of funding from City of Longmont in comparison with some of the other cities. And I was trying to see if that had to do with you serving many more Longmont clients, patients. I forget how they're referred. Is that the reason why there's so much more for Longmont?
Yeah, we're really involved with the Longmont community, and I think that's an excellent question. You know, just our location gets we overlap in a lot of areas, like Weld County. We have people from Frederick and Firestone who work in Longmont, who then also want our services. But yeah, it's very much a Longmont organization. The fact that we fill a gap with all free services and serious structured recovery services. For all of our structured classes, we use Hazelden Betty Ford materials, and those are the best materials available in the market, evidence-based, cutting edge. I feel really strongly that everyone should have access to high quality healthcare, regardless of income. So all of our services are free, and anybody can come in and get a first class IOP treatment at no cost.
Beautiful. Thank you.
Thank you, Martha.
All right. Last chance for questions, and then I'll give Debbie her time if we don't have any questions. Okay.
Okay, no other questions. Yeah, so I am so happy with the way forward and the services that we provide, the gratitude that I feel from our clients every single day. I hear multiple times a day from people that we saved their life. And you know, I have to say, this disease, it is a matter of life and death. When people come in, I tell them once we've crossed that line, and I include myself in that, once a person has crossed that line, there are only three choices: locked up, covered up, sobered up. And that's really the size of it. And so I take our work really seriously, because I do see it as a matter of life and death. It's so important to provide a welcoming environment for people to find a sober community, to get in the middle of the herd, to learn how to do things without using substances. for people who've never experienced a substance use disorder, that might be difficult to understand, but it really does start with those baby steps. We look at healing mind, body, spirit. That's what recovery is about. So we offer a meditation group. We offer AccuDetox twice a week, art classes, writing classes. We have a wonderful, easily accessible historic home right in downtown Longmont. We're right across the street from Mental Health Partners. And that is a wonderful collaboration of people can come across the street to us and get services immediately. One of our board members works for Mental Health Partners. We also get numerous warm handoffs a week from leads. And so we're really involved with the community. Our house downtown also has a carriage house, which up to this point has been an art studio, and we've had various art programs. We're now expanding that to make that just a wellness center for the meditation groups, for AccuDetox. And then we've grown so much, sometimes we need the space to meet individually with clients, do the individual coaching there. It's also a safe space for groups that might want to be more autonomous. Last year, in response to some of our clients, we started a group just for educators. So that is a space where educators can be a little more anonymous and meet there and get help. So,
That's great. Thank you, Debbie.
yeah.
All right. So appreciate your time. Thank you for being here. Just a quick rundown of what happens. You know, we're going to be doing these hearings through the end of October. November 14th is our deliberation night. We'll have a conversation then and decide the allocations. We take those recommendations to council. Ultimately, it's council's choice. They typically don't change our recommendations as a board, but they have that prerogative and that right to do so. So, and between here and there, we'll let you know about
Okay.
the decision. Okay.
Okay, great. I really appreciate all your time, and thank you so much for doing what you're doing.
Thank you, Debbie. You too.
Okay, nice
Thank
to see you,
you.
Alberto.
Nice to see you
Bye-bye.
too, Debbie. All right. Again, this will be a fast night. It's going to go fast. If we have time, we'll take a break somewhere in the middle. But our next group is already in the waiting room. We're 3 minutes ahead. I'm gonna let them in because there might be a time where we're 3 minutes behind. It happened to us on Saturday. So I'm just gonna let them in and we're gonna keep going. Hi, Lynn. You with the autism from Boulder County, right?
That's me.
All right, awesome. Are we expecting anyone else?
This will just be me.
Perfect, perfect. So we'll introduce ourselves in a minute. Just want to give a quick rundown. This is your first time being here, so just want to give you kind of a picture of what's going to happen. You're going to get 15 minutes of Q&A from us, so we'll be asking questions about your application. At the end of that 15 minutes, if we happen to use the entire 15 minutes, we don't always use the entire 15 minutes. We will give you 5 minutes to share whatever you want to share with us, and then you'll be done. It goes very quickly. So it's like the board members. So why don't you introduce yourself, and then the board will introduce itself, and then we'll get started.
Great. I'm Lynn Weiss-Wilmersky. I'm the president of the Autism Society of Boulder County. I've been president for about 5 or 6 years now. And then prior to that, I was a special ed teacher in Boulder Valley School District. And I've worked with folks with autism for the last 25 or 30 years. I do not have a person in my household who has autism, but I do have family members and friends who are on the autism spectrum. And I've been working with ASBC probably for the last decade, as a teacher, referring people to them, and then on their board, and now as their president. And we're just a
All right.
small local group. So
Great. All right. Who wants to go first on the board?
I
I'll
can
go
go first.
Go ahead,
Go ahead,
Jeffrey.
Kim. Hey, Lynn, I'm Jeffrey Boring. I'm a new advisory board member, so I'm a volunteer with the City of Longmont. It's nice to meet you.
nice to meet you as well.
Nice to meet you, Lynn. I'm Kim Stringa, board member, of course, as well. And I believe this is my 4th year on the board.
Martha Wilson. I'm in my 1st year on the board still, but this is my 2nd go around for the reviews. I'm a therapist and I work with parents who have open child welfare cases, and I'm excited to hear what you got.
And I'm Heriberto Mendoza, Human Services Program Manager. I help facilitate this process. So I'm going to go ahead and start the 15 minutes. And again, we don't have to use it all, but I'm gonna go ahead and start it, and then we will give you your 5 minutes. All right. Any questions from the board? Go ahead, Kim.
Yeah, I really enjoyed reading your application, and it made me think about what other agencies are doing similar work within Boulder County, and if there's any overlap of services or any gaps in services that you identified.
There are agencies that provide services for folks with disabilities. There are a few just general, like parents with disabilities support groups. We have not come across too many support groups for adults on the spectrum or seniors on the spectrum, and parent support groups that are free. So the gap that we found is primarily access, because we keep them free for everyone. But when a kid has autism or you have autism, funds go to places that are therapeutic or to make things more sensory friendly, or all kinds of places that you never expected. And so support kind of takes a back burner. So we try to make sure that it's free. And also support groups can be either in different towns or different counties. And for a lot of people, it's really hard to have a support group that's not where you live, either because it's impossible to find childcare. You can't, as one parent said to me, I can't travel 30 minutes, be a support group for an hour, and have another 30-minute drive home. I have to be in Longmont. A lot of adults on the spectrum either have transportation issues where they don't drive, or they have certain areas they're willing to go to. And so we don't really overlap in that way with other specific groups, in that they're paid, a lot of them, or they're elsewhere. And so those are the gaps that we really try to fill, is to make sure that they're accessible for people and that they're local, and also very specific. That's the other thing that we do. Autism, there's a perception that I have these adorable autistic kids, and then somehow they grow out of it. And there's not a lot for parents of kids who are teenagers or tweens, and there's not a lot for adults, and there's almost nothing for people who are seniors. So we try to fill those gaps as well.
Thank you.
So then I'm going to ask some. So I try and help our applicants understand a little bit of the process as well through this. So our board members really focus on the program section of the application. You filled out a pretty long application. Our board members are looking at the program. I, as staff, my job is to really look at the agency piece. And in particular, there are a few things that I look for. One of the things that I always ask, and I'm always looking for, because we are, as a city, this is taxpayer dollars, and we want to make sure that we're funding agencies that are sustainable and that will be around to be able to deliver the services that they're applying for, right?
Mhm.
And so one question I always ask is, what is your board, what are some of the strategic goals that your board around the agency sustainability? I mean, what I read in your application, a lot of great goals around, the programmatic stuff that you do, which is fine. But I really want to know is, are you going to be around? Like, so you've been around for like, what is the board looking at as far as being financially sustainable, just an ongoing resource in the community?
I always tell people autism is a self-renewing resource. So we try not to have too many service providers on our board. We always have the opportunity to have parents and teachers on our board. So as far as having, and our board is structured so that it's strength based. So we have a person who's in advertising. We have a person, and all these people are parents of folks on the spectrum, or they are autistic themselves. We have a professional photographer, those kinds of folks that really want to help the organization, and we give them the opportunity to work with their strengths. And that's been our sustainable model for the last 20 something years. We have primarily relied on big donors, on private donors, to keep ourselves going. And we've been different sizes over the last decades. And we also get some support from the Autism Society of America, which is going to have its at least 60th anniversary this year. So we're solid in our membership there, and we're solid in the community. We're just, and so as far as looking towards the future, we are moving more into writing grants. This is our first year of doing that, and my first year of figuring that out. We've written grants before that are tiny, and then depended on certain folks that have donated, in the large scale for those funds. But we wanted to really, those folks that do that tend to be like, oh, well, my nephew is 14 and he's autistic, so I want to pay for this. And that's why we're hoping to expand out into more grants, so that we can be specific to the needs that come from the community, not necessarily always specific to the needs of our donors. We also do rely a lot on volunteers, which I'm really lucky to have just a huge group of people that will volunteer. And so right now, all of our support groups are run by volunteers. And we've sustained that for over a decade, always having, and part of that is that we like to, our autistic adult groups are run by autistic adults. And parent support groups only want experts in there maybe 3 or 4 times a year, but not necessarily every month. They like having a parent, even though that parent might be a therapist or a counselor or a group facilitator, they like having another person who's having their same experience. So we are sustainable in that way, and that we have just a huge resource for volunteers. And I've had that for a long time. We have a bike clinic that we have every year, and I need 100, like literally 100 people to show up for free for a week, and we can pull that off. So those are, we're leaning on our deep roots in the community and on the community itself for sustainability. Does that answer your question?
Yeah, I think it starts to answer the question. So that's
Okay.
good. I'm also going to ask a question because that I've been asking to every agency on behalf of my supervisor. So this funding. So just so you know how this funding comes to being, City Council has set aside 3% of our general fund that comes from sales and use tax for this human services funding. But what we've seen lately is we've seen an increase in demand and request, new applicants like yourself. And while the amount of funding we've gotten has increased a little bit, it is not keeping up with the demand. And so the question that she has been asking all the agencies is pretty simple. Given the fact that of the fiscal reality that we're facing as a city, what is the impact if your application was either partially funded or not funded at all?
If it's not funded at all, we find a way, and we are small but mighty, and we run real clean. We have no problem knocking on doors to find space. It does make it less stable, for sure. Having volunteers makes it less stable, and it makes us less nimble. As far as a good example is, we have a support group for tweens and teens. And right now, that group is run by a parent volunteer who's excellent. Her job is to be a facilitator. And she is doing that for free. And then that would continue if we got zero funds. If we got some funds, that she is willing, if we provide her with a stipend, to hold two groups, one for tweens and teens that have very significant challenges. And what I mean by that are autistic kids who don't speak yet, who may not be potty trained yet, who may not be in the general classroom, and who are also having puberty issues, but they're different than autistic teens who are looking at what high school they want to go to, social issues around pardon me, going to homecoming or joining a sports team. They're the exact same age, and so they are currently in a support group together for free, but they're starting to diverge in their needs, if that makes sense. So we would pay this person to hold the two support groups. We would be able to expand. What I would love to do, is to take that group again and have a Spanish speaker work with another group of teens and tweens, because that's another different experience. And then if that group still had like the challenges, the separation through challenges, which they probably would, to be able to hold, to really drill down on people's needs, because what happens is it's less efficient. 1 week or 1 month, we might be able to say, this month I can hire someone who speaks Spanish and these people can get support, but their kids are autistic 24 hours a day forever. So what we would like to be able to do, and we will do, is scale as best we can financially as times change. So.
Thank you.
Sure.
Any other questions from the board?
Yeah, I've got a quick question, and I think I read that there are a couple of different activities that were offered in your application, and some of those are more frequent than others. I think I read that you are offering monthly programs for kids in some communities, but in Longmont, just twice a year. And help me. Did I misunderstand that? Okay.
Yeah.
Yeah. Help me understand that.
Okay. Yeah. Longmont, we are partnering with the Tinker Mill in Longmont, and we provide free memberships for autistic people. And what's great about the Tinker Mill is they are inclusive of everyone. So we have folks that go to the Tinker Mill that are very high needs, that have 24-hour support, and we pay for them to be full-time Tinker Mill members. And they learn job skills there, and they work on different skills, on learning different skills. One young man is an artist and is able to go to shows because they're able to create like the backdrops and frames and things. But he goes there with a caregiver. But right now so in Longmont, we have 15 people that access them, and we pay for that every month, and we have for the last 4 or 5 years, and that's not going anywhere. Our bike clinic, is once a year, and that's a 5-day thing, and that is in Longmont. And that is, it's very intense, but, and then we do have a once a month support group in Longmont. Our adult support group does meet or try to go on a social outing in Longmont once or twice a year. It's super hard to get those folks to go out and commit to anything. But yeah, in Longmont specifically, we have a lot of parents who would like to have more opportunities for support groups there, but we do have the Tinker Mill and the bike clinic and the adult outings out there.
It mentions a bi-yearly gatherings in Longmont, but it's more often than biannual.
Is that's
the social meetings though?
The social meeting, yeah, that's the adult thing where people will come out either to go out to dinner or to go do, there's just do something, out there, go to a comedy out there, go to, whatever. The adult group ones are super hard to get a lot of people to. So we might get 3 or 4 people to that twice a year. Part of that is that we can only offer it twice a year. Adults on the spectrum like routine. And so if it's not routine, it's a lot harder. So it takes us 5 times, and then it becomes a thing we do all the time.
In full transparency, this funding would not probably fund that activity. It would fund your in-person support groups, those monthly meetings. That would be, because we don't fund social events, but we would fund if you were funded, we would fund the support group work that you do in Longmont.
Yeah, and that's really what we're wanting to do in Longmont. the parents that reach out to me that are in Longmont, they just, and I know it sounds crazy, but they're like, we just cannot drive to Boulder. We just cannot drive to Louisville. I have to do it here. And which is great. Like, we can use the Tinkermill space in Longmont for free if we have to for that space. We've got, you know, an online adult group there, but the ability to leave town is just extremely hard for people. So that would be our focus in Longmont, is to get those in-person groups going.
Yeah, that's what, if you do get funding, that when we do the agreement, that's what that would be what the agreement would fund, is those, because it's in the priority of health and well-being. So that's what we would fund if
Yeah.
if you were recommending funding.
Great.
Again,
That's what we're looking for.
we got about 30 seconds of the 15 minutes. So any last minute question the board has? All right, then I'm gonna stop ours at 20 seconds, and then I'm gonna give you, Lynn, your 5 minutes to tell us whatever you want to. And you don't have to use it all, but starting your 5 minutes now.
Great. Yeah, no, I understand that these would be for support groups in town. I just want to make it like it's super clear that the reason we want to make sure that these are in Longmont, again, is that they're accessible for people and that they're free for people. And why we're looking for funding is that we do want to expand the specificity. We really find that if I can find one volunteer to come meet with parents of people with autism, it's far too general, and it's too hard to have a parent of a 4-year-old with a parent of a 30-year-old in the same support group, with a parent of a 16-year-old whose child had a meltdown over their prom dress, while someone's afraid their child will never go to prom, and someone else whose child didn't even come within 100 meters of the prom. And so it's really important to us to be able to get the funds to pay facilitators, to have them come out to Longmont itself, and then also to have folks like a lawyer to come to each of those different groups and talk about how you would plan your estate, to have someone from the state to come talk about how to plan finances, because when a person receives state funds when they're an adult, how to get through that system. Those kinds of folks that would really be helpful to parents in a support group cost money. And having a safe space that people are comfortable in, that they know they can go to every single time. And in some cases, somewhere that might be child friendly, those things cost money as well. And so that's why we're seeking this funding. We do provide support groups, but they're, to get the most out of them, we really do need to grow them into things that are more specific, that are in a safe space, and that can offer opportunities for learning that people need over time, especially, parents, but also adults. We have like 3 senior citizens that do have Tinkermill memberships. Occasionally they say hi to each other there, but they would like to have a support group. It's really hard for them to figure out, what did they do if they are not married, or they don't have families, or they are having a lot of state assistance. What do they do with their funds when they die? Those kinds of problems for senior citizens are very specific, that are autistic senior citizens. We want to be able to expand and offer those things to people. So, and for us to be able to do that in the town that they live in, and then to really be able to point them to places in Longmont specifically that are autism friendly, or people that are in Longmont that are experts that can help them, would just make such a huge difference for this community and for these people. So I just appreciate the opportunity to apply, and I'm super glad that you asked me to talk. And if you ever have any questions, you can reach me at president@autismboulder.org, and I'm completely open to answering them at any time.
All right. Thank you very much. Then, so just last minute, what's going to happen is the board is going to evaluate. We're going to have through the rest of October, all the different applications. We will have a meeting in November to decide our recommendations. Then we will take it to council in December. We can send you, if you do get funded, we'll send you a letter saying this is our recommendation. The reason I say it's the recommendation is because council does have the prerogative to change any of our recommendations. They typically don't, but I always give the caveat that they can. It's because it's ultimately under their auspices of the funding. And so yeah, I will, either way, whether you're funded or not, I will contact you sometime after November 14th.
Perfect. Great. Well, thank you so much for all of you for your time. I know this is a lot of work and I appreciate it.
Thank you.
Bye.
Bye.
All right, the night continues to go fast. We have the next person in the lobby already. And we are 1 minute ahead of schedule. If we can keep that going. Hey, Frank.
Hello, everyone. Hello, Alberto.
All right, so you are an old hand at this. You know how this goes. We're going to give you 50 minutes of Q&A from the board, and then we'll give you 5 minutes. Just as a reminder, this is, I forgot to tell the last person, this is a public hearing, so it is being recorded and will be on the City of Longmont YouTube page. We're going to let you introduce yourself, and the board will introduce themselves, and then we'll go ahead and get started.
My name's Frank Okanya. I'm the Executive Director for the Boulder County East Project, also known as BCAP. And I've worked at BCAP for a bit over 20 years and in the role of Executive Director for a bit over 6 years.
All right, thank you. Board, who wants to go first?
All right, I'll go first again. Hi, Frank. I'm Jeffrey Boring. I'm a brand new volunteer with this advisory board. Pleasure to meet you.
Likewise.
Hi,
All right.
Frank. I'm Kim Strenga. We've met before. I remember you from last year, so it's good to see you again.
Thanks for staying on the committee for a while.
Hi there, Martha Wilson. I'm in my first year on the board, but this is my second go around in reviewing. I'm a therapist and I work with parents who have open child welfare cases, and I'm excited to hear what you got.
Nice to meet you, Martha.
All right, you know me, Liberto Mendoza, Human Resources Program Manager. I help facilitate this process. All right, so I'm going to go ahead and start our 15-minute timer. And we'll start with any questions from the board. Go ahead, Jim.
In reviewing the application, it's always great to see how much good work is happening. And I was curious to know, I noticed Boulder County Public Health being mentioned. And I remember when I was employed at Boulder County, that testing often happened within the county offices. And I was wondering if that collaboration is still there. Are they still doing testing and linking those who test positive to you? What does that process look like, both at the county level and then also in clinics and hospitals, that connection and supporting that client through from discovery of that positive result?
Sure. Yeah, so BCAP is still in a very active collaboration with Boulder County Public Health for a number of prevention services, including HIV, hepatitis C, and STI counseling, testing, and referrals, as well as harm reduction and syringe access services, as well as PrEP, screening, navigation, and linkage to care. And so we coordinate, and in a really formal way, they really help ensure that we get technical assistance, quality assurance support, and access to supplies to ensure that the service is ongoing. We do strategize around where we're delivering the service. So they do focus heavily on the Boulder Jail, and they offer a lot of testing through their Works program, syringe access services for people who use and inject drugs. We provide service at our Boulder location. We are also in 15 community partner locations throughout the Boulder region. And we also do a lot of outreach and geomapping on sites where people meet sexual partners like Grindr, to promote the service and to get people into care. So when people get tested, it typically is about a 30-minute to an hour experience. And so we do a number of mental health, behavioral health screenings. We do some education around HIV, around PEP, around PrEP. We deliver test results. We try to actively, if somebody's coming in for an HIV test, also get them a hepatitis C test if it makes sense, and STI testing for syphilis, gonorrhea, and chlamydia. The Boulder County Public Health passed on securing the state credits for STI testing. Some passed on offering that service. So the state reached out to us and we're basically the regional entity for that service. So we're able to offer STI testing through state lab credits. So we do active referrals for that service, as well as mental health, housing, really all the basic needs supports. If somebody tests positive, we do help with confirmatory testing. So we'll work actively with disease intervention specialists through the state health department who will come to site and run a test to confirm that the person actually is living with with HIV or hepatitis C. And then we'll help with the linkage to medical care and helping to link to medical case management. There's a lot of public benefits that are available through the state health department, like the state drug assistance program to help people access medication and get support with their premiums to make sure they have health insurance, or if they're uninsured or underinsured, helping to ensure that insurance support, as well as if they're experiencing really intense, a number of intense issues, they could qualify for a program called Critical Events, which can offer a lot more support within like a 6-month period that can help with like housing, utilities, transportation, inpatient, outpatient, whatever that person is really needing security around. But we have the expertise in terms of knowing how to navigate those systems and help people fill out those applications, get everything in order, and access the benefits if they're living with HIV that are common at the state level, but not common at the county level or the city levels.
Super helpful. Thank you.
And then we also get a lot of calls from medical providers when someone tests positive. So we'll show up to hospital, we'll show up to clinics, and really help with that active linkage to care or do consultation over the phone.
All right. Any other questions from board members? If not, I'll ask. Oh, go ahead, Martha. You go first.
Not so much a question, but you guys put up an impressive amount of letters of support from different organizations.
Mm-hmm.
I was curious about like how many people specific to Longmont are able to benefit from your services, and if there's going to be like anything different between this year and last year, like if they're specific to Longmont.
Sure. So essentially BCAP serves the Boulder region, which is Boulder, Broomfield, Gilpin, and Clear Creek counties. And we've secured the federal state funding through the Ryan White program to provide services to people living with HIV. So about 15% of the people we serve are from the city of Longmont. It'll range 15 to 20% each year. That's going to look like about 60 people living with HIV that we provide case management to. That's going to, and so helping link people to medical care, to treatment, doing wellness plans, assessing acuities. We have a pro bono psychotherapy team, so linking people to pro bono psychotherapy. We have a health insurance assistance coordinator, so linking people to health insurance and helping them understand their benefit, irrespective of how they're accessing health insurance, really understanding what their health insurance includes and how to navigate that. We hold the TBRA, tenant-based rental assistance subsidies, the federal subsidies for people living with HIV for our region. So placing people living with HIV, which includes people living in Longmont, into that sustainable housing subsidies. And we also have a group home where we house some people living with HIV, and that will include people in Longmont as well. So that's about 60 people living with HIV. We're going to provide the HIV, hepatitis C, and our STI testing to about 60 to 80 people. And realistically, in a year, we'll provide harm reduction and syringe access services to about 100 people who are using and or injecting drugs, experiencing homelessness. And then we'll provide kind of touch points like outreach education, maybe an educational presentation to students in a high school or at tabling events. We'll reach about 1,800 to 2,000 City of Longmont residents that way. But in our application, we focused our deliverables on the wraparound services to people living with HIV and those acuities if they get high. I mean, a case manager is working with those people on an ongoing basis, weekly touch points in some cases, working on a variety of issues. Essentially, we want to provide all the supports for people living with HIV that are necessary so that they can get into medical care, see the doctor, both for general health care, HIV specialty care, any other specialty care, and really anything that's going to help stabilize the HIV in their body so that it can be repressed at very low levels to optimize their health and well-being, as well as make it impossible for them to transmit HIV to anyone else sexually.
Okay, thank you.
Thanks, Frank. Oh, go ahead.
Sorry, super quick question. That brings up the question that I had, that it was very clear that undetectable levels meant it couldn't be transmitted sexually, but does that mean that it can still be transmitted through IV drug use, shared? It seemed like that was a very intentional conclusion. So I'm just curious.
Yeah, I think it removes essentially the possibility if someone has an undetectable viral load, it removes the possibility of them transmitting the virus sexually to someone else. It just won't happen. It will significantly lower the risk of somebody transmitting HIV to someone else through injection drug use and sharing needles. But it just lowers it. And different studies have shown different percentages. It's still a relatively high percentage, like I've seen like over 80% around that area, but it's not like it doesn't remove the possibility.
Okay, thanks.
So Frank, I just have a couple of questions. One that Christina's been asking everybody, our director, and then one in particular around your program budget that just want to make some clarifications on it. So let me ask her a question first because our time is going. You know, we're dealing like everybody else in the city dealing with like everybody else in fiscal realities that are hard. And you know, this has always been a competitive process. But what we see in the last couple of years is just the increase in demand and the fact that our resources are not keeping with the increase in requests and demand. And so the question that she's asking everybody, just so that we have it on video, is, you know, if your application was either partially funded or not funded at all, what sort of impacts does that do to Longmont services?
It's a great question. I think it's a similar question across local government, you know, because we've secured a service coming to the Boulder region. Right now, we're the only HIV service organization serving Boulder County, including the city of Longmont. State federal budgets, you know, have their elasticity as well, and they also have what's allowable to fund and what they just don't fund. So BCAP relies on the combination of county, City of Boulder, City of Longmont funding to kind of fill in some of those gaps. The impact, if we're, you know, not funded or partially funded, it just comes down to how much time and effort what can our staffing level look like and how much time and effort can we give towards certain services. So it at times can translate to a reduction in the amount of hours we're spend providing testing in the community, doing outreach at events. But that's all scalable, right? You know, all things considered, we present for the services we're offering for the region, we present a pretty humble request to local government compared to what we're bringing in and securing for the region. with federal and state money. But I do think it's important to keep HIV, hepatitis C, at the forefront of Health and Human Services. So it has always been a priority to be in active collaboration with local government and the city of Longmont to bring this cause forward, because should federal funding change for HIV, what would be needed from local government to continue to contain the impact of the HIV epidemic and minimize transmission and keep people living with HIV alive would be a much taller ask in order from the county and the cities to handle this.
All right, so we got about a minute. But my only clarifying question is, when I look at your program budget, there's some that's set aside for direct financials like rent, and we don't typically cover that kind of finances. So, you know, if you do get funded, we'd have to shift that around and put it more toward your salaries, because that's not something that we cover with this funding. Most of the other stuff looks just fine, but that's the one thing that we wouldn't potentially cover with.
Just to clarify, that's in a larger bucket that includes food pantry assistance. So if awarded that 2,000, it would be used to purchase food for.
Okay, wait, sorry, my bad. It's wrong. You have it on the right thing. I'm wrong. I'm looking at it again. These spreadsheets sometimes confuse me. No, you're right. Yeah, that's allowable, right? The because it includes the testing, syringe, the access. Yeah, that would be fine. Sorry, my bad.
That's okay. Yes.
Yeah. All right. All right. If there's no other questions, I'll give Frank his 5 minutes, and then in those 5 minutes, I gotta take a quick break, and I'll be right back. But I'm gonna get that going first, and you can talk to the board. Give you your 5 minutes.
On any particular aspect?
Anything about your organization that you want, anything you think the board needs to hear about the application or your organization?
I think I'm repeating myself a little bit, but I think the most important thing to know is that we are the only HIV service organization serving the Boulder region, serving the city of Longmont. So anybody living with HIV, typically people living in poverty, the accessing the public benefits is really complicated. So they do rely on working with a social worker, a case manager on an ongoing basis to really survive and to figure out if they can, how are they going to live in this region? How are they going to work toward a sustainable rent, get on Section 8 housing, get a TBRA subsidy, find a sustainable way to meet their basic needs. And then also to get linked to medical care. And that can take its own navigation to get on treatment, to understand why it's so important to adhere, and then to have their housing, utilities, food needs met so that they can continue to take that medication. It is an investment in those individuals. The city of Longmont is investing in those 60 people, but they're also investing in anybody that those people would become sexually active with. If we can help get them to a repressed viral load, then the virus just can't be transmitted that way. And that's the majority of how we're seeing transmission in the city of Longmont among people living with HIV. So it really also is investing in a broader public health goal to minimize transmission and lower the community viral load. So it does have a dual purpose. And then we are also the only entity in the region that is providing no cost STI testing. So for somebody to come and just be able to access it without working it through insurance, without any additional steps or complications, just scheduling an appointment. We have the only bilingual PrEP services navigator. So we're the only entity with a full-time person who focuses on PrEP access. And that's how we're also going to get ahead of this epidemic, is getting people who are at the greatest risk of HIV acquisition on a daily medication that if they take that pill, they won't acquire HIV if they're exposed. It just doesn't happen when they're on that medication. And the greatest disparity in our region is amongst Latin people. And although there's such a great need, a lot of people aren't accessing that service because there's not bilingual staff with this expertise to help them navigate also a state program that can help pay for most people. Like if you make under like 600 FPL, you can enroll in a program that will help create access to this medication. And we have like all of our services are also offered in Spanish. They're bilingual. We have the only program for men who have sex with men to work group level interventions connected to that program. So there are a lot of the things that we're doing. We are the main entity doing it for the region. I think that's just really important to punctuate. And then you can also see, we try to show representation of how we're utilizing our relationships with community partners to be able to bring this service to where people are at and who are experiencing some of the greatest challenges in our region.
All right. Well, Frank, thank you so much for being here tonight. Just a quick, and again, you've been doing this for many years. We're gonna be doing hearings through the rest of October. We have our deliberation meeting in November. As soon as that's done, I'll be sending out letters of what the recommended amount of funding is. We take it to council in December, and then I always say this caveat because I have to. Our board's going to recommend funding, but ultimately council is the one who approves it. They also can change it if they so desire, but they typically don't. But I always put that caveat because it could happen.
Of course.
So with that, thank you for what you all do at BCAP. I know you're an important service to this county and to this region, so I appreciate you.
And I appreciate all of what you're doing to get this funding out to all these incredible organizations that are also so deserving. So thank you.
All right. Have a good night.
Have a good night.
Frank.
Take care.
All right. Now we're a minute behind. And I just took a quick break. If everybody should take care of yourselves, go ahead and do it. There's enough of us here that we can run the meeting. So I'm going to let the next person's already waiting. I'm going to let them in and we'll do what we do and get going. Hey, Bruce.
Hey, how are y'all doing tonight?
Good. So really quickly, I'll let everybody know that this is a public hearing, and so we are being recorded, and it will be on the city YouTube page at some point. Well, the way it's going to go down is we're going to let you introduce yourself here in a minute, and the board will introduce themselves. Then we'll have a 15-minute Q&A time from the board. We don't have to use all that time, but if we do, that's fine. But I will make sure you get 5 minutes at the end to share whatever else you want to share about the application or the organization. So let's start with you introducing yourself, and then we'll have the board introduce themselves, and then we'll get going.
Hi, I am Bruce Parker. I am the Deputy Director at Rocky Mountain Equality, formerly out Boulder County. I've been here for 2 years and 11 months. And I've enjoyed myself quite a bit. I'm sure folks may know about us a little bit. We rebranded in June, and I can say more about that at the end. But I have a PhD in education and have a lot of human services management background from my time in the Louisiana Governor's Office, disability affairs, elderly affairs type work. Louisiana did not have an LGBT specific human services function at all. And so, yeah, that's who I am.
Awesome. All right. So we kind of got a routine going. Why don't we start with you, Jeffrey?
Sure. Hi, Bruce. My name's Jeffrey Boring. I'm a relatively new volunteer on the advisory board. I've just been around for about 6 to 9 months. Nice to meet you.
Nice to meet you too.
Hey, Kim.
Hi, Bruce. I'm Kim Stringa. I've been on the board now I think this is my 4th year, and it's nice to see you tonight.
Martha.
Hi, I'm Martha Wilson. I'm in my first year on the board. This is my second go around in reviews. I am a therapist and I work with parents who have open child welfare cases. And I'm excited to hear what you've got for us.
Awesome. And you know me, Andy Mendoza, Human Services Program Manager. So I'm going to go ahead and start the 15 minutes now. Give me 1 second. All right. Does the board have any questions for Bruce?
I mean, you said you were going to cover it at the end, but I was curious about the rebranding myself, just because I have high schoolers who were connected at some point to out Boulder County.
That's fine. Totally good question.
Yeah. When I got here, the organization had already started doing attracting some youth from outside the county coming to stuff from surrounding counties. And during COVID, when a lot of programming was virtual, which was still going on when I got here to some extent 3 years ago, we were getting actually some folks from out of state and from around the state. And so I tend to be really honest, and I will tell you that I think that before I got here, Marty and the team did a good job of capitalizing on the opportunities that COVID presented. And I think having a young staff really helped. Marty told a joke yesterday about like waking up one morning and suddenly there were Zoom groups set up and one of the staff had to teach her what Zoom was. And I think we all had some version of that, right? And so I think from there, when I got here, we launched the Point, our behavioral health program, sort of in earnest. The first hire that I made was Tamora Tannehill, who was a counselor from the community who had done our youth programming. Her and I had a lot of success getting statewide behavioral health funding to expand our behavioral health services. I think there's always a need for that, and it is fair and always true to say there's an LGBTQ mental health crisis and a more broad mental health crisis that was only exacerbated by the pandemic and then political rhetoric targeting minorities, women, LGBTQ people. And so Tamora is a very effective leader. We've had a lot of luck with that funding. So we ended up expanding rec service in person to Larimer and Weld counties. At still is out Boulder County. We have an office in Larimer County. We're getting money from their local government at this point too. Foundation support. We do a really good job of diversifying our fundraising. So it's like government grants and funding, like foundation grants and funding, individual donations and corporate donations. And it stays pretty best practice and balance. But all of that is to say, I'd been here for 2 years and Marty and I realized that we were serving a lot of people out of the county. And the needs of the community don't stop at the borders of the county. And so why should our work? And honestly, I think we're doing something unique in the state. Very few organizations do the direct services pieces that we do and the advocacy pieces and the communications pieces. Usually have organizations that are one or the other, and we're sort of a clearinghouse for all of it. And so I am proud that the number of people we have served in county, in Longmont, in Boulder, in Lafayette has increased as we've also expanded out of the county. And so actually it's funny, like the thing we say is like, people ask me, were y'all nervous about living up to the rebrand? And the thing is we already got there. The name caught up with the work of the organization. I moved here to work at out Boulder County. I love that it's in Boulder County. I love the work that it's done. I think this will stay the home of the organization forever. I hope that we are successfully continuing to expand our services, particularly youth and behavioral health stuff, because I think the need is just so vast across the state.
As a therapist, I can 100% verify that. The numbers that are shown here kind of shows that the larger population is like 18 to 54. Is that accurate?
I missed a word that you said. The blank of our population is 18 to 54.
The bulk?
So I think, I don't know what numbers you're looking at exactly, but I will admit to you, I write grant proposals until I'm blue in the face, and so the numbers are blurry, but I have it all spread out in front of me trying to follow it. Our youth program is one of our biggest direct service programs. When you look at our holistic reach around, which includes Pride and some other big events, the numbers skew towards older. And so I think that balances it out. I would say the behavioral health program and the youth program are our biggest direct service programs. And the youth program serves if I'm remembering correctly, at mid-year, we had basically doubled what we had done last year. And it was going up on 700 people, I think, including the speaking out panel system that we have. And so the youth program is pretty large, and it's the young folks in it. I will say we count young adult. There's a couple activities that are young adult specific that 18 to 26-year-olds will get counted in, that those folks are also counted in our other programming depending on what they're attending. And so if it's ran by the youth program and it's sort of developmental focused versus if it's social or social support focused, it may get grouped that way. So youth stuff is robust, but we do serve a lot of adults. We're seeing an increasing number of people who are 50 plus. The need is really high there because of the loneliness stuff that's going on. And sort of like we know, like public health data, right, that's the biggest threat to 50 plus people. And then the LGBTQ folks of that generation often don't have kids. And so I think that's changing with younger generations of the community too, but so that loneliness piece is real. So we're increasingly trying to make sure we're reaching those folks with our sort of therapeutic support groups and with our activities and events. I'm also exceedingly verbose, and saying anything in 15 minutes is hard for me, so I apologize. You don't spend 20 years in school getting a PhD and not learn to ramble. So I'm trying to like.
Amen. Okay, I'm glad you shared that, because like the number in here is for kids is 10, and I know that it's more than 10. I've seen more than 10. So thank you for sharing that.
I think that is pulling from, we have done a really bad job historically of collecting data. We collect it, but there's been no system. In the last 2 years since I've been here, Mikkel Duffy worked there, and one person was the system, and thankfully they were brilliant, had a master's in sort of science and could do that. And so it was all justifiable, but a lot of guessing was involved. And so the numbers you see in tables like that are the things that I can prove with data. So the youth camp, for instance, isn't always collected demographic information. So we had 38 kids go to youth camp this year. They didn't collect the county. We've streamlined all of that. We have a Salesforce system set up this year. Starting next week, actually, the system called Receptionist that people use to sign in to collect demographic data is being implemented. And so I am very excited that starting in January, there'll be real numbers that are coming directly from people that aren't us having to guess and tease apart what they attended. And so obviously there will still be some folks who don't check in consistently and mistakes will drop, but it's going to be so much better to show our impact and also to sort of avoid having to comb through stacks of stuff constantly to try to make our best guess at stuff that's defensible.
Awesome. Jeffrey.
Yeah, are there standards and practices that organizations like yours follow? Or is your organization just so different that there isn't a kind of a set of standards that you strive for?
I'm going to ask a clarifying question, Jeffrey, just to make sure I understand. And when you say standards and practices, like what area are you talking about of the work?
Yeah, so as an evaluator, one of our responsibilities is to review the application and see if there are industry standards that the applicant follows, and is there proof that they've met those standards, or do they have some improvements to make sure that the services they're providing are valid and meet those expectations. And I'm just not as familiar with your organization as some of the others.
Yeah. As a nonprofit leader, I feel like I should say to you that we home run all of that. But as like a person, I value honesty. I'm 44 and I've been in this career field since 20. This organization does a better job of that than anywhere I've ever worked. There's still always ways to improve. So data collection is a really good example for you of a challenge. And part of that challenge is when I started here 3 years ago, there were 9 employees and now there's 25. So just the things we're collecting data for has grown a whole lot. But I would say there's accounting standards for nonprofits that we are really, really good at. We've passed clean audits for the past, 9 years, I think. And before that, we just weren't being audited externally. This year, we had a much more extreme audit because we thought we might cross over next year into having gotten so much federal money that we had to do a single source audit, which is much more detailed. So we brought in a firm that does that to help us prepare. I don't think we're going to hit that now, thank goodness, but we passed that with flying colors. They had nothing, no findings that were substantial for changes we need to make. They do 2 letters. One is to management that tells you ways you could get better, and the other one's to the board, and the full, like the public one that says things that you did that aren't correct. We got nothing on the incorrect. There were 3 things on the get it better thing. We've already implemented some of them. To give you an example of one of them, there was no practice in place for someone to approve Marty's mileage if she traveled as the ED because she has no direct staff supervisor. So that was a thing that we adjusted. She doesn't turn in mileage. I don't either really, but that was a good example. The youth program and the behavioral health program both do a fantastic job of following best practices in those fields. Tamara is exceedingly ethical. I'm going to give you an example of a mistake that was made and how we fixed it as an example. There is a therapeutic support group that has 4 attendees at the time. The staff member, a junior staff member, sent out an email to that list, was supposed to be CC the 4 attendees and CC'd them. So those 4 people saw each other's email addresses a week before the group started. Well, that's a HIPAA violation. It's kind of a no harm, no foul one, I would argue, as not a HIPAA professional. Tamara, we contacted the people we needed to contact. We notified them formally. We also drafted an email to all of the attendees whose information was shared that said, this happened, please disregard, this is how we deal with it. So we do a really good job, I think, of following kind of industry standards inside of each of the programmatic areas we have. A lot of the areas don't have that. So like the trans programming, the cutie pot programming, you just try to be ethical and make good choices. But youth, behavioral health, fundraising, operations, there are clear standards that we work really hard to meet.
Thanks for explaining that.
Hopefully we won't ever do that again with the email addresses shared, but I was very relieved it was 4 people and not 40.
Right. Yeah, exactly.
BCC, every time I email the board, I BCC. That's always my go-to. It's also Colorado Sunshine Laws. So yeah, we have other laws that we have to follow. Real quick, our time is running short. Thank you, Bruce, for all the answers you said. I have a comment and then a question that our director has been asking everybody. So I'm gonna make my comment first, and then I'll ask my question. My comment is I want to give you kudos. My job in reading your applications, I mean, I do look at the program stuff, but that's not what I evaluate. I really evaluate your agency level piece. One of the things that in that agency piece that I really look for from nonprofit, because it tells me that the nonprofit is being thoughtful about sustainability and being thoughtful about its future, is I look for whatever strategic goals that you list on that question. And I was very impressed with your strategic goals. I'm not sure when you all did the strategic plan, but I was impressed with those strategic goals. I think that they're comprehensive. I think that they're futuristic, looking to be how do you expand and still be sustainable. So I just want to give you kudos for that. I thought those were great.
Thank you.
Now here's the hard question, because we've been asking this of everybody, and it is a difficult question. What we've seen in the last couple of years in our funding program is we have seen a huge increase in the demand and requests that are coming into the program. Unfortunately, while our resources have increased a small bit, they are not keeping up with the demand. And that's just a reality. And so the question that Christina's been asking everyone is knowing that reality, knowing this is a competitive process, what are the impact of services if your application is either partially funded or not funded at all?
My joke with Marty and Tamara in the office, Alberto, is that you are as tough as my doctoral committee. And so thank you for the positive feedback. I do a ton of these interviews and you always are one of the toughest. And then when we sort of work through deliverables, you have helped me get better at being precise in defining them. And I think it's helping us overall. So thank you. And also it makes me crazy. So, there's 2 answers. And the first answer is the need that we're seeing is increasing too. The election, the political rhetoric makes it even more intense. One of the things that I'm proud of is a lot of LGBT organizations are so hyper-focused that it doesn't bleed out to impacting the entire community. I think a lot of the work that we does affects the entire health of the community that folks live in overall. And I if we had more time, I would point to examples of that, but I think it's just really clear in law enforcement, in emergency response, in schools, in hospitals, in data collection. Like we make a difference. And it's not just through advocacy, it's through the ways that our social support services work. And more we treat LGBTQ people and their families, and more people who are impoverished or who are unhoused. So that piece is just real. The need's growing. We have a pretty substantial budget cliff this year, and it is because of Behavioral Health Administration funding that was funded through ARPA dollars that go away in June. And the salary sponsorship pieces actually run out in December. And then the county ARPA money that we receive goes away next December. Now, I'm balancing sort of being honest and realistic with the fact that I am optimistic and things work out, in saying to you, the need is high. We also didn't get a Colorado Health Foundation grant that has funded us for the past 3 years for the youth program. And they told us we were a victim of our own success, that the program is doing so well that they diverted the fundings to other areas. And that was a substantial part of the youth program funding. So we're in this interesting posture where we are financially solid, and I am not super worried about our future. And also in this interesting posture where I don't know right now. I spent all day in the room with Marty doing budgeting. We're almost done with next year's budget. There's a lot of unfunded stuff right now, and that doesn't mean we won't fund it. But honestly, I think most of this programming will try to go on. I think the pieces that we included that will be the hardest to sort of like replace the funding for if y'all didn't fund us, and if we weren't funded by the other sort of HSF funds, are let me see. I have the secretary in front of me. I'm acclimating myself. You won't fund basic needs assistance. You told me that last year, but the other HSFs do. And so one, y'all should do that. It's important and changes people's lives, but that's a fight with me and Alberto for another day. So that one, I understand that we won't get funding from y'all for. I think that the sort of bigger ones are the case management stuff. We don't know how we're going to retain those staff. Like that's real. I think we will. I couldn't tell you how today. That becomes much more dire in July. And that's the honest answer. And one of the benefits of your all's funding is we have some flexibility with where we spend it throughout the year. And that's not true with all of the funding. I believe we have pro-social activities in here, if I'm remembering correctly. Am I making that up, or is that in here?
No, it's there.
Okay. That is hard to replace. That is funding that came mostly from BHA right now. We're seeing huge success rates in that, both in terms of helping build resilience and build connection for people and their self-reported like mental health and wellness outcomes. We're also seeing that it funnels people into the case management and other direct services more clearly and easily in a way that builds confidence and trust with people. So those are the pieces I'm the most worried about finding funding for to continue. And that's kind of the honest answer. I will also say we're fairly determined to provide these services to people. And I believe that we will solve it if we have to. Every person that says no because resources are getting less makes it harder to do.
Okay. All right. So we are a little bit over, but I'll still give you your 5 minutes at the end to share whatever you want to share about the application and or the organization.
Can I give it back and let y'all ask any other questions you may have, because I know that I am long-winded.
Of course, yeah. Any other questions that the board has? And if not, then that's fine too. All right, how about you do this? How about give me summarize as best as you can this application for the board today, so the board members. Well, actually, I think everybody who's evaluating is here. For those that are not here, but I think everybody who's evaluating is here. Let's put it this way. This is going to be on YouTube for the City of Longmont. Anybody else can see it. So what would you tell the community?
Thankfully, I will say the same thing publicly I would say privately, so that works out well for me. And the first thing I will say is the challenge I was given is y'all have never funded us fully for our request. And so I was like, Marty, I'm going to get it this year. Like, we're going to get this done. And so I just know that I have hope and faith. Things are going to work out. I think that we have kind of figured out how to do this really well using best practices. over the last 3 years, and I think they were already doing it, but I think adding the behavioral health team and adding professionalization around that has helped infuse best practices in behavioral health and wellness and case management into all of our work. So every area is doing a better job of tracking data. Every area is doing a better job of having cleared goals and deliverables, and every area is doing a better job of making sure everyone is getting connected to all the resources we have available. So I think the application that you see in front of you is maybe the best we've ever put forward in terms of that too, because it is holistically capturing various parts of the work that feeds into each other. And we're no longer funding sort of like individual departments. Like this used to fund mostly our QTPOC work through City of Boulder. It now funds the services and the programs that kind of cross department in a way that I think is super effective. And so what I know is we don't waste money as an organization. We do a very good job of keeping admin costs low and getting the money and the services to people they go to. And I think a good example of that is the basic needs funding. Any funding we get of that from anybody, we take no administrative cost out of that. We give that directly to people who need help buying groceries or paying for rent, right? So we've kind of mastered that. Really proud of the model we have, and I think this application captures it really well. People need social support. People need resource referrals. This connects to other applications we have out about providing therapy for people, like, and paying co-pays for people who can't afford it, and the youth program, which is so robust in various ways. So I feel really good about the work we do, and I think that it is captured well in the application.
All right, thank you very much, Bruce. So we have our so October we have hearings. In November we'll do our deliberation, and we'll decide the allocations then, and then I'll be in contact with you, and then finally we take it to council in December. I always do this caveat: they have prerogative to change anything that we recommend, but they typically don't. But I always just let people know that.
Yeah, thank you all so much for taking the time to do this with all of us. I know that you're funding a lot of important stuff, and these are hard choices.
Yeah, thank you, Bruce.
Thanks, Bruce. Have a good night.
All right, so now we are officially 5 minutes behind. Again, always have these great conversations with our nonprofits, and yes, Bruce and I, we had some good conversations when we were working on the agreement. So I'm going to go ahead and let Erin in. She's from Boulder Valley Boulder Valley Health Center. Hey, Erin, can you hear us?
Hi, I can. Can you hear me?
Yes. Sorry, we're running a little behind tonight.
That's okay. I know you guys have had to talk to a lot of people. Thanks for talking to me.
It's been some great conversations. So just really quickly, we are being recorded. This is a public hearing, and it'll be on our City of Longmont YouTube page.
Okay.
What we're gonna do is I'm gonna let you introduce yourself. We're gonna let the board introduce themselves. Then we'll have a 15-minute time for Q&A from the board. We don't have to use that whole 15 minutes if there's not a lot of questions, but then we will give you 5 minutes at the end to share whatever you want to share about the application and or your organization. So why don't you go ahead and introduce yourself, and then we'll let the board introduce themselves, and then we'll get started.
Okay, sounds great. I'm Erin. I'm the grant programs manager for Boulder Valley Health Center. I've been there for about a year. I did this hearing last year after I had only worked there for about 3 weeks. So I'm feeling a little bit in a better place to talk about the org than I did last time. But it's nice to meet you all, and thanks for doing this.
Awesome. All right, Jeffrey.
Sure. Hi, Aaron. My name is Jeffrey Boring. I've been on the advisory board now for about 6 to 9 months, so I'm a newbie.
Nice to meet you.
Nice to meet you.
All right, Kim.
Hi, Erin. I'm Kim Strenga. I've been on the board now. This is the 4th year, and I remember seeing you last year in this process. So good to see you again.
Good to see you too.
All right, and then Martha.
Hi there, Martha Wilson, no relation. I'm in my first year in the board, but this is my second go around in the reviews. I'm a therapist, and I work with parents who have open child welfare cases, and I'm excited to hear what you got for us.
Thank you. Nice to meet you.
All right, you know me, I'm Alberto Mendoza, Human Services Program Manager, and I'm going to go ahead and start the timer, and we'll get going. All right. Any questions from the board first?
So I'm super excited about your application. I just love the fact that you're providing gender affirming care and PrEP to the community. And I was curious, because of the financial limits with accessing PrEP, through your services, can anybody who's eligible in terms of meeting the criteria clinically get PrEP? Or is there still a limit on what's available for folks in the community?
No, that's a great question. So PrEP, I was excited about this too, because PrEP is a brand new program for us. So we actually just had our first patient in September. So this is brand new, and I think I'll have a lot more to say about it at the next meeting. But we have a partnership with Gilead, which is the drug maker of PrEP, that allows us to get low cost and free PrEP. So patients that qualify for our sliding fee scale can get PrEP either for super reduced cost or even for free if they're a code 1 patient. So our most low income patients can get it for free.
Awesome. Thank you.
Yeah, does that answer it okay?
So Aaron, if the board, I do have a couple of questions. And we talked about this when we went to go visit you earlier this year. So one of the things that I review as a staff member, I mean, I read the program stuff, but that's not what I primarily focus on. I really look at the agency level, in particular around your business practices and making sure that the agency is in a good position. And I guess the question I had, one of the first questions I had is when I read the agency narrative and I was looking for strategic goals, I really did. I saw, a conversation about agency being at a turning point, but I wanted to kind of get from you a better, clearer picture of where is that turning point? What are the strategic goals that are coming about by what's the changes happening at the agency? I really didn't get a good sense of that in the narrative.
Sure. So hopefully I can answer this okay. We actually just closed this week on the building next door. So when I was talking about the turning point, something really big that happened this year is that the building that's next door to our clinic, where we've been since the 90s, went for sale. And it opened us up to this really big vulnerability because we share not only a driveway with this building, because it's like just sort of this grandfathered in old situation of these two houses, but we also share parking spaces with them. And so we were in a spot where we either needed to think about moving or purchasing that building. And at the time that I submitted this application, I don't think I knew yet what we were going to do. But we first explored moving, which was kind of shattering to those people, especially that have been there forever. And, people just know us and know where we are, especially the student population in Boulder. But we were able, through the support of a donor, to purchase the building next door. And so the goal that we have now is to expand into that space, which is not only going to increase our capacity, but it's going to allow us this kind of separation that we really need logistically and administratively, which is we're a Title X clinic, so we get federal family planning dollars. We're the only Title X abortion provider in Colorado. And it's great because it allows us these sliding fee scales that we just talked about a little bit, but it is complicated because Title X money cannot mix with abortion care at all. And so when we have a patient who comes to us for an abortion who also, let's say, wants to get birth control pills or an IUD, those have to be two separate visits. And it really limits our ability to be efficient because we have to separate the visits, unroom the patient, bring them back, put them in a different room. And so the big vision over the next couple of years is to expand into this building next door, make that into our administrative offices, and then separate our clinic into two separate floors so that one floor is abortion care and one floor is reproductive health care. So all Title X family planning type of services. So really the big goal there is to increase capacity because we'll be able to be so much more efficient with that separation. And Aliberto knows, like, especially since the pandemic, we've really struggled with retention. And I think that in the year that I've been here, we are really finding some solid footing now where we're starting to have people that are here for a year, 2 years, 3 years, which are big numbers for us. And so the other big part of this expansion is really people having a comfortable home at the agency, having their own offices, having a place where they don't feel cramped, having a place where we can actually take a lunch break that's not the same place where people also have meetings, and really just settling into that space so that we can grow and we can keep the great people that we have. Does that answer your question, Eliberto?
Yeah, partly. I think it does. I mean, I still, yeah, and I'm gonna follow up with more on in the email, but because of time, I do want to ask a question that um, that my supervisor, our director, human services director, she has been asking every agency.
Okay.
And I think you've already experienced this last year as an agency, because as I explained last year, and we're in the same situation this year. What we've seen is just an increase in demand and requests. And while our resources are going up a little bit, it's definitely not keeping up with the demand. And so the question that she's been asking, just so that we have it on the record, right, is, if your application gets partially funded or not funded at all, what sort of services impacts can we expect for Longmont?
That's a hard question. I know I asked for a lot more than we received last year, and I felt justified in doing so because we see so many patients from Longmont. I think in our agency, we are lucky to have this federal family planning money, and so that certainly supports a lot of our patients without outside funding. And we also are really lucky to have a really strong donor base in the local Boulder community. We have a lot of people who have been donating to us regularly for 10, 20, 30, 40 years. And so I don't know exactly how to answer the question, to be honest. I want to say that, our whole mission is to see anybody who walks through our doors. We never turn away a patient for financial need. And so I guess I would just say that we would have to lean more on those other sources. We would have to lean more on our sliding fee scale. We would have to lean more on our donors, and we would have to lean more on the other local governments that support us, like Boulder County and the City of Boulder, to cover those patients. Because I can't say that we wouldn't see those patients. I don't think that is truth based on our mission.
Well, based on that, I mean, I guess the follow-up question I have is, you closed your office in Longmont a couple of years ago for very legitimate reasons. And how has that changed? What has that impact had on the amount of Longmont? Now that it's been a while, what's the impact that you've seen as far as number of Longmont residents accessing your services?
We see a tremendous amount of Longmont patients. When I looked at the percentages of these numbers of patients that we see for reproductive health care, it's about 30% of our patients coming to us from Longmont. I can't speak to what the number was when that clinic was open because I wasn't here. I would be glad to research that though and get back to you if you want to know, Eliberto. But it does seem that Longmont patients are getting to us in our Boulder clinic, because after City of Boulder, City of Longmont is the next highest group of patients that we see in our location in Boulder.
Okay. All right. Thank you. Any other questions from the board? Jeffrey.
Yeah, I had a quick question about the sex education programming you offer. I'm just not that familiar with it. So are these offered within the school, or these are extracurricular activities that they participate in with your organization? How does that work?
These are offered within the school. So we have a partnership with Boulder Valley School District and also with St. Vrain Valley. And every school doesn't participate. They all are eligible to participate, but it's up to the teachers and the administrators to opt in. But our educators work with those school districts to make sure that they're meeting the Colorado state standards. And so essentially a teacher can say, I'm responsible for delivering this information and I'd like to farm it out to your educators to come in and do this curriculum. So the education that happens is within schools within the school day, and it's all middle school and high school students in those 2 school districts are eligible. So a lot of it is based on teachers that have done it in the past, and they rehire our educators every year to come back in. Each year we're really expanding and trying to get into more school districts, and we've hired, since I've been there in the past year, the team has gone from 1 educator to now it's up to 3 to meet that demand. So we're getting into more and more classrooms each school year. Mostly it's right when school gets going, like right now, once students are like about a month in, the lessons really ramp up. And then towards the end of the school year, they ramp up again. And then something that's new this year that's outside of the school system is we have this new partnership with CU Boulder with the Renee Crown Institute to do some summer camp programming, and that's open to any student that meets the age criteria, and it's free of charge. So that's open to middle and high school students, whether they're in those school districts or not.
And it looks like there's an emphasis on media and sexuality. Is that a new topic, or is that something that has been a focus for many years?
It was a new topic that they piloted in the school district last year. So they tried it out just with a handful of educators that they had worked with, teachers that they already had partnered with. And basically they came up with a curriculum as a result of getting so many questions that students were basing on things that they had learned about consent and bodies through media exposure. And they decided to write this lesson. I think they piloted it in 9 or 10 schools last year. And then they had all of those students and teachers evaluate the program, and it caused them to want to expand the program because it was so popular. So this year it's being offered in every school that they have a partnership with. I believe it's only high school students, not middle school students.
Okay, great.
Yeah.
Thank you.
Yeah, of course.
All right, any more questions from the board? If not, I will go ahead and give you your 5 minutes to share whatever you want to share with us.
You know, I really was going to share about the expansion because I was excited to tell you guys about that, but it felt like the right thing that I needed to tell you when you asked the question. So I want to respect your guys' time. I don't really feel like there's anything else I need to tell you, except that I did try to be really conscientious with this application to make sure that all the things that I'm talking about here, all the programs, are really measurable and reportable. That was one of the goals that I really wanted to improve upon from last year when I kind of inherited these things. So I just want to say, like, I feel confident that I'll be able to really accurately report on this. And I feel excited about that as the person who runs grants for us. So that's why we chose these things that are measurable and we put numbers on them. And I am excited, like Kim mentioned, with the gender affirming care and also with PrEP. Those are just 2 brand new programs for us. So it feels exciting to have the opportunity to try to grow them with this funding. So that's all.
All right. Well, thank you so much. And so just so you know, we're going to be holding hearings throughout the rest of October. We have our deliberation evening on November 14th, and I'll be reaching out after that, and then we take our recommendations to council. Always give the caveat that while we can make recommendations, council does have the ability to change recommendations. They usually don't, but they can. So with that said, thank you so much for being here this evening. Appreciate your time, Erin, and I know you all do great work. Yeah, thank you so much.
Thank you guys. Thanks for being here and for the questions. Take care.
Bye. All right. Second to last meeting. They're already in the meeting room. We'll go ahead and let them in. If you want to take care of yourselves, go ahead and do that. That's fine. Let me let them in. This is Community Roots Midwife Collective. All right. Hi, Stephanie.
Hi.
Hi, Josie.
Hello, good evening.
All right. Well, thank you for being here tonight with us. I'm just going to give a quick rundown how the hearing is going to go. In a second, I'm going to let you all introduce yourselves. Then our board members will introduce themselves. And then we have up to 15 minutes of question and answer from the board. And then at the end, we'll give you 5 minutes to share whatever you want to share. We don't have to use all those 50 minutes, but we want to give the board the opportunity to ask questions about the application. So with that said, why don't you all introduce yourselves, then the board can introduce themselves, and then we can get going.
Josie, you want to go first?
Wonderful. Yeah, thank you all so much. My name is Josie Valadez Fraire. I am the Community Bridge and Ancestral Women Postpartum Care Program Coordinator at Community Roots Midwife Collective. And I'm here with my amazing colleague, Stephanie, who I will go ahead and give the palabra to.
Thank you. I'm Stephanie Minert. I am fundraising and administrative coordinator for Community Roots Midwife Collective. Nice to meet you all.
All right, thank you. Jeffrey, you want to introduce yourself?
Sure. Hi, Josie. Hi, Stephanie. My name is Jeffrey Boring. I'm on the Housing and Human Services Advisory Board. I've been on the board now for about 6 to 9 months. So this is my first round of applications. Nice to meet you.
Thank you. Kim?
Hi, I'm Kim Strenga. I've been on the board for about 4 years now, and I think I remember you, Stephanie, from last year if you were part of the application process. So it's good to see you guys here again tonight.
Martha?
Hi, Martha Wilson. I am in my first year on the board, but this is my second go around. I do remember you guys from last year. I'm a therapist and I work with parents who have open child welfare cases. So I'm excited to hear what you have that's maybe different from last year.
All right, awesome. All right, so, and you know me, the Mendoza Human Services Program Manager. I help facilitate this process. So we're gonna go ahead and jump into question time. I'll start with the board to see, have any questions?
I had a question. Your application is just so fascinating to read through because there's a lot of things that you incorporate into care and healing that I'm not familiar with. And one, I think it's called the bone closing ceremony. So I was curious to know what that entails and how that supports healthy outcomes and healing in general for individuals. Absolutely. Yeah. So the closing of bone ceremony, or as we call it, cerrada de caderas, is an ancestral tradition within several different Mesoamerican indigenous communities. And so for us, we specifically practice the Mexica way. And what we do is we offer hands-on physical support for folks who are needing tending to their womb or abdominal space. After birthing, so in their postpartum period, sometimes after sexual assault or traumatic experiences with their bodies. That could include medical traumas or even just medical procedures that, left scarring or pain, discomfort, a variety of things. There's a huge range of reasons why we would do a cerrada. And so within that ceremony, we also tend to the emotional, spiritual, and mental well-being of folks who are coming to us for care. And based on the circumstance of the care that they need, the ceremony pivots a bit to meet those specific needs while staying true to the traditions of this ancestral practice. And we do offer a couple different options in terms of how the cerradas take place and where they take place. Some folks prefer to have a cerrada in their own home or somewhere that they choose is safe and comfortable for them. That might be a family home, a friend's home, the home of one of our healers and practitioners. Or sometimes folks also choose to have a cerrada within the cedar sauna that we have at Elk Run that's available for our use. And so each of those options also kind of entails some different modalities and techniques within that healing. The way that directly ties to the health and well-being of our communities is that not only are we providing culturally relevant care and culturally affirming care that preserves the traditions of the peoples that we tend to and our own communities, but it also directly addresses the health concerns, whether that be physical, mental, emotional, spiritual health concerns of people that are coming to us for care. And the way that we hold those ceremonies is quite unique, not only because of who we are and what we're offering, but also the way that we offer a really like integrated and holistic approach that many healthcare services and approaches just cannot meet for a variety of reasons. And so in this care, we're also addressing the systemic racism and inequity that we already experience as people of color, as Indigenous peoples, as people of the global majority, and offering a space where the healing can take place in a way that's not only trauma informed, but very healing centered. So it is a pretty unique ceremony and offering that many people don't have actual personal physical experience with. But our communities have generations and generations of practice and wisdom within this tradition. Does that That's amazing. Definitely. Thank you. Yeah, thank you.
All right. I have some questions as well. So, typically, the board focuses on the program side of the application. I read that as well, but I really focus on the agency level. And so I want to say that I appreciated your organizational goals, and I just wanted to get for you to expound a little bit on one of those goals. Um, so, and then I had a question about just target populations that we are working with, but so one, you talk about maintaining sliding scale service to ensure financial accessibility for under-resourced communities. What does that look like? How do you besides Longmont funding, which you apply, this is your second year applying, how are you sustaining that and developing that, growing that so that you can keep that sliding scale process available?
Yeah, I think I can jump in here. Community Roots Midwife Collective is really a unique organization because we are out of hospital midwives and we are a nonprofit, and that most midwives that are serving this country are solo practicing, or they may be practicing with another midwife, and they have pretty small just they're just solo, so that's they don't have what we have, and that we can apply for grants. So we do have other foundations that we're working with. We're working with Caring for Colorado, where we are in relationship with Colorado Health Foundation, for example, and some other local ones. Additionally, we take in grants or donations from individual donors who have donor advised funds, family foundations, who just love our work. And so that really is how we're sustaining this sliding scale, is being a nonprofit. And one of the things, the line items that I included in the request this year that's a little different, is that we are wanting to expand this sliding scale because we aren't the only midwives who are doing this work. And like I said, most of the midwives are just solo practicing. They do a lot of unpaid work. And so being a nonprofit, we also know that they are engaging with under-resourced families that we aren't engaging with necessarily. And so we're trying to really expand that reach. And so one line item was to support those midwives who are supporting other under-resourced families within the city of Longmont, and paying them to do that work. Otherwise, they're just not getting paid. So that's another way.
That's a subcontractor piece that you
Yeah.
haven't. Okay, I was gonna ask
Yes.
about that. Okay. I guess the other question is something that we've been asking for, that we've been asking every agency, at least my director, is, we are in a situation at the city that we're, while our resources went up a little bit, we are still seeing way much more demand than we can cover. And so the question that she's been asking every agency, the same question is, given that reality, what are the impacts to services in Longmont if your application is either partially funded or not funded at all?
Yeah, that's a good question. I mean, do we have other opportunities for funding? Absolutely. And being within the nonprofit world, I feel like this is like a huge stress that we all take on within our work is where is the next funding going to come? Where is it going to get cut? And so, um, yeah, it just means that some of our work isn't going to happen, or that we have to make cuts somehow. You know, maybe we will be able to cover it with a new donor potentially, but I mean that is the reality of the situation.
Yeah, I understand. It's difficult. It is difficult.
And also we recognize that you all do have limited funds, and we got around 18,000 last year, which we were really happy with, and this year we did ask for a little bit more, but I feel like we kept it within a pretty reasonable request for a little bit more, just knowing that you all have a lot of organizations to reach. So
Any other questions from the board members?
I heard you say that you wanted to expand the sliding scale, but when I looked at the application, it said unknown for the income level of the clients. How is your sliding scale applied if that's not something that's being asked? Just out of curiosity.
yeah, we ask a lot of questions in our sliding scale, and Josie, also feel free to jump into, because you know, within our youth work, it's similar. We're not directly asking people like, what is your income? I mean, we're asking them a lot of different questions, but also a lot of the work that we do, we aren't having them fill out this sliding scale application. And so I feel like we could maybe in that question answer those people only for the sliding scale, but we serve a lot of different people. So say we're going to an event, and we're serving 200 people at that event, we don't ask them for their income. And so honestly, those questions around the demographics and breaking it down, those are really hard to answer. Yeah.
I'm a mixed person, so like I get the like
Okay.
it could be a number of things. I was just like wanting to hone in on that because like if you're outreaching to a school, you're not going to necessarily ask a kid what's your income level. But I wasn't sure, and it didn't have like a comment box or anything under that section, so I wanted to give you an opportunity to tell us.
Rosie, do you want to elaborate? I know you may have something else to share too.
Yeah, thank you. And part of that, is like Steph mentioned, not only like the different types of work that we're doing, but also the different folks that we're serving and supporting. And so within our communities, especially communities of color, undocumented communities, or the folks that we're serving that actually experience quite a bit of discomfort in having to ask some of these like somewhat legal or logistical questions, it can be tricky to get some of that information. And the nature of our work is also just so relational, right? So a lot of our information does come from those one-on-one conversations, folks, our clients meeting with our midwives individually. So like Steph mentioned, kind of like a larger scope of questions versus like one boiled down, what is your income kind of question that can be captured for everybody. So it just kind of lends to our organization being quite a bit different in how we operate and structure a lot of our work, including how we offer assistance to the folks that would otherwise not be able to access our care.
And you can find our sliding scale application on our website. And also, I will just be transparent. This is one of the things that we are trying in this coming year. We want to do better about tracking and getting more information from people. So for example, say someone comes in and they just get a like a womb tending visit, and they do it ends up being a sliding scale visit, or it's free essentially. We don't exactly have the best evaluation method or data collection in place to get all that information from them, all those details that a lot of these government grants, now that we're starting to get funding from them, really ask for. And so we do want to do better about tracking this, and it is one of our goals for next year.
Your application, I think, listed 5 different activities. And I was just curious, this is a hard question to answer. I appreciate that. But I wonder if you would comment on which of the activities you feel like is most important to your target community, and take a little bit of time and walk us through those programs, those activities, what the costs are to provide those services.
And you got about a minute and a half to do it, so.
I'm just scrolling to make sure that I get, because this is tough in that we have 2 main programs that we're really trying to fund. One of them being the ancestral women postpartum care work, and then we also have our overall midwifery services. I would say I'm not going to list them because I want to make sure I answer your question quickly, but like I would say that the to me what feels like the 2 most important things, if I'm going to pick 2, are our ancestral women postpartum care work. We are starting up, we didn't even talk about First Moon, but this youth work that we're doing is really incredible, and it's going into its 2nd year, and we're looking to expand it and splitting the youth into 2 different age groups, for example. And so that work feels priority to me, in addition to the ceremonies that are happening. And then also our sliding scale midwifery work. I feel pretty confident that we have our events, our nursing nook and our milk circle pretty well funded. And so those are the two things that I guess 3 things that feel really important to fund.
Mhm. I would agree as well. I also feel like the urgency of the work that's happening within those realms, for like the health needs of our community is of the top priority for our organization as well, where like other areas of our work maybe are more well funded, but also just maybe more access depending on who the clients are or the folks that we're serving directly with that work. So I would agree with Stephanie that the ancestral women postpartum care, youth work, and ceremonies that are like caderas, and the sliding scale work to support other midwives in our region are really important.
All right, thank you. So our time is up. So I'm gonna give you your 5 minutes. You don't have to use it all, but for you to share whatever you want to share about the application and or your organization.
Feel free to go, Josie, if you have anything that comes to mind right now.
Yeah, I mean, our application is lengthy, you know, and I think in a lot of ways comprehensive to what we do, the work we do, the importance, the folks we serve. Just really wanting to emphasize how the investment that you all could put towards our work is, for us, really an investment towards our communities. Not so much just funding a program, but really investing in the health of our communities that are most in need of prioritizing, and also like that faithful, effortful support that comes from the place where they live, the place where they call home, feels like a really incredible opportunity that I'm really humbled to have the opportunity to speak to you all about and to share with you a bit more, to keep bringing those messages forward, you know, that are coming directly from our communities, the needs that we're responding to directly from the things that have been shared with us in these last years of our program and the shifts that have happened over the years. So yeah, I just feel really grateful to have this opportunity, and I know you all have a difficult position and decision to make, and I don't envy that position at all. But yeah, just feeling really called to share that, you know, in kind of reframing the way that some of this funding process can look for a lot of organizations, and really centering the people that are at the heart of our work.
Stephanie?
May I ask a question? Is that
Yeah.
allowed right now? Just to,
Yeah.
okay. Eliberto, you were saying that, I mean, I guess I took it as maybe you're looking to do more funding cuts, or you have more organizations that are asking for
Yeah,
increase.
Yes, that's about cuts and more the second thing you said.
Interesting. Yeah.
Yeah, it's not about cutting, it's we have more.
Yeah, this is nonprofit work is tough. It's tough. Yeah. So yeah, I also find it really interesting that the city of Longmont takes the time to do this. I think, it does add another layer to the grant process, which can be kind of like daunting for grantees. But I do feel like it's nice that we all get to speak with you and you get to speak with us. And I just want to, yeah, thank you all for the opportunity, because I do think it adds a little something different for you all to see faces and hear directly from us. And not a lot of other grants funders do this kind of thing.
Yeah, so because we have a board, we want to make sure that the board gets the chance to make the most educated, informed decisions by getting to talk to you a little bit. So yeah. All right. Well, thank you so much for the work that you do. We appreciate it, and have a great night. Well, Joe, real quick before you go. So what's going to happen? We have funding hearings the rest of October. The board's evaluating. In November, we'll meet and make recommendations. I will reach out to you after that. Then we take our recommendations to City Council. City Council, Mayor, they typically don't change their recommendations, but they have the ability to do so. So just want to make sure that I point out that. So, all right. Have a good night.
Thank you so
Well,
much.
good night.
Thank you.
All right. Last group, you all have made it. So appreciate you all tonight. This is our last group coming in now. This is Centro Amistad and their Promotores program. Hola, Jorge.
Hola, ¿cómo
Hola,
estás,
Wendy.
Alberto?
Muy bien. So apologize for the tardiness. We just had some really good conversations and it went a little bit long, but we'll make sure that you all have your time for tonight. So thank you for being here tonight.
Yes.
Yeah. Before we get
Thank
started,
you.
I'll just kind of go a rundown of how it's going to go, and then we'll jump right in. So in a second, I'm going to let you all introduce yourself. One quick caveat is that this is a public meeting, and so it's being recorded and will be on the City of Longmont YouTube page at some point in the near future. We're going to give you 15 minutes of Q&A with the board, and then at the end, we'll give you 5 minutes to share whatever you want to share with the board. So why don't you go ahead and introduce yourselves, and then we'll get started.
Yes, thank you, Alberto. Hello, and I just want to apologize. I don't know what's going on with my camera. It keeps turning off. And
that's okay. You can keep it off.
All right. Well, my name is Jorge de Santiago. I'm the executive director of El Centro Amistad, a nonprofit organization based in Boulder. And well, first of all, I want to thank you for all this availability tonight. I know it's been a long night, and I want to allow Wendy.
Thank you, Jorge. My name is Wendy Chaides. I am part of the Amistad team. I am currently the case manager and also the compañera de bienestar emocional comunitario at Amistad. Thank you. And yeah, thanks for your time and for connecting and tuning in.
I am muted. Sorry. Jeffrey, go ahead and introduce yourself.
Sure. Good evening, Jorge and Wendy. My name is Jeffrey Boring. I'm a relatively new member of the Housing and Human Services Advisory Board. It's nice to meet you both.
Nice to meet you.
Kim?
Hi, I'm Kim Strenga. This is the 4th year that I've been on the board, and it's nice to meet you both. Thank you for being here.
All right, Martha.
Martha Wilson. I'm in my first year on the board. This is my second review, though. I'm a therapist, and I work with parents who have open child welfare cases. I'm excited to hear what you've got to present to us.
All right, awesome. And you know me, Alberto Mendoza, Human Services Program Manager. I'm going to go ahead and start the 15 minutes. And we'll see if the board has any questions about the program.
Thank you, Alberto. Well, thank you. We just want to say, thank you so much for, the support for the last couple of years. Has been a great support for the Latino families in Boulder County, but specifically in the city of Longmont. Since we started working in the city of Longmont, we have seen the expansion of really getting families connected to different resources, especially not only with our organization, but really connecting with the broader resources in our community. I think the main goal that we have in this moment is to continue really supporting the needs that we have seen and discovered for the last couple of years in our community in Longmont. Since we started leasing an office, 2 years ago in Longmont, we start seeing more connections with the community. We have a more visibility. One of the biggest things that we see right now that I want to have Wendy to share in a little bit with you is really seeing the impact and having the resources that this funding has been provided to the families in Longmont, really making a difference. The whole range, having families with children, just families with teenagers, and now one of the biggest, components that we have been adding for the last couple of years have been adding the elders, 65 and older, who have been a great group to connect as well. So one of the things that that's what I invited Wendy to really share is how the component of mental health support has been really making a big impact in our communities on top of everything that we have been offering. But this component has been making a difference to really providing the support that the families really need right now, and really assessing not only the basic needs of the families, just we went broader. So Wendy, could you share a little bit about what the program has been doing in the city of Longmont, please?
Absolutely. Thank you, Jorge. Yeah, like Jorge mentioned, we started leasing an office 2 years ago, and this is when I also transitioned a year ago into the case manager, and I started realizing the big effect and the need that there is in our community. Being an early childhood educator myself and getting into connections with the Wild Plum Center in Longmont, I started discovering and getting all these referrals from community members in our Spanish-speaking community that felt that their voices weren't being heard. And getting the services through Amistad, they started realizing that they are getting services from people that have their same stories, that speak their own language, that connect with them in a deeper way. We get referrals on a regular basis. We have monthly meetings, which we call Círculo de con unas compañeras de Círculo de Bienestar Emocional, which we call Manteniéndonos Saludables, staying healthy, and these are based on emotional well-being. So we have groups of 20 people showing up from different ages. Our youngest one was 17 and 18 years old, all the way to, so Jorge said 65, 63, and this is people who we meet once a month, but when the meeting ends, they're already asking, when's the next one? When are we meeting again? So these are topics that they also get, to share with their own community, people who speak their own language. And I've been seeing more and more referrals on a regular basis, and living myself in Longmont, introducing myself into Longmont, this makes me feel that my community, because I want to include myself in it, is finally being heard and thriving. Yeah.
Thank you, Wendy. I think that's excellent. And I wanted to really talk about that component because everything else that we have been providing, the support to families around, healthy eating, really providing more diabetes prevention to families with children to prevent, really the diabetes epidemic within our communities. The connection, that we have through the groups, community groups that we have done. I think here in the community, really making a statement technically by really accessing the services and the programs that we have right now, specifically around mental health, has been a really great, I think, asset to the community in Longmont. We thought, this is going to be a slow, having, families and children coming to the programs in the mental health in the programming. But technically what happened, we have on a weekly basis, we get referrals. Now we have, sometimes we even get a waiting list, so the capacity that we provide right now to the funding that we're getting, I think this has been really worked well, to support and avoid the waiting list and the waiting period time for those families to access, anything. The rest of the programming, they have access on an ongoing basis, from the Promotora program that gets supported on a weekly basis to access to different vouchers for fruits and vegetables. There is a program that we collaborate with the Boulder County Public Health, and we manage those families who are enrolled in that program. So we try to offer a very holistic approach, not just by participating in one program that we're going to get one service. We try to offer the whole package to the family. Specifically, they have children, teenagers, and elders. One of the other pieces that I want to mention is that we have been creating more spaces in collaborating with some of the schools to really providing more. We recently just started the group, the Escuela de Padres and Madres. It's specifically for parents, Latino parents. Right now, we just started the Columbine Elementary. This curriculum is based on the DBT skills. Technically, we just provided a curriculum for parents to be more available for their children. And this is something that is very exciting because now I believe we have like 12 parents. Out of those parents, we have 4, dads coming to this weekly group, for 90 minutes. So I think to me, see that there's an interest for the parents to participate. So we providing access, trying to provide that connection specifically for everybody, So right now, one of the challenges that we have seen, but we push and try to get more collaboration with the schools is getting more programming for the teenagers, after school programs, especially emotional support. We recently just hosted our annual youth conference in Boulder. So we have students coming from Longmont to participate. So just an example, in high school students specifically, for that was this year.
So Jorge, I'm gonna stop you there because I have a question and our time is
Yes,
running
sir.
out, which is great. Thank you for sharing about your programs. But I have so the board looks at the program part of the application. I look at the agency level. And I think one of the questions that I had that I didn't get a really clear picture in the application was really around, so you're growing and you're expanding. What are some of the strategic goals that you and your board have looked at to continue to be sustainable in this growth and expansion? In particular, can you talk to me about your financial sustainability?
Yes, thank you. Well, right now, it's a perfect timing. Right now, the board, they are going through a really specific capacity strategic planning that we are working with this couple of consultants, and that we are part of this core of organizations that the Colorado Health Foundation has been funding. It's a capacity building grant. So one of the areas that we choose to really provide capacity was for the board. And part of the board was looking at long-term, financial capacity. So part of that strategy is really working on really looking at long-term strategies. We have been working with, part of our analysis has been seen, we've been receiving more funding from government and foundations than for individual donors. So creating a campaign to go for individual donors, all that kind of stuff. So technically right now we're working as we're speaking, really creating that planning for the future, for the next 2 to 3 years to really create, because we understand we're growing and we have to continue the capacity to continue supporting the families.
Any other questions from the board? Because I got one more. I forgot. I've been asking this question of everybody. So Christina Pacheco, our human services director, has been asking this question of every agency, because we are in a situation where our fiscal situation puts in a place where, while our regions are growing a little bit, they're not keeping up with the demands. It's just we get many more requests than we have in the past. And so the question that she's been asking is, given that reality, what are the impacts to Longmont if your application gets either partially funded or not funded at all?
Well, it will be a negative impact, specifically for those families who have been recently accessing some of the programs that we just, provided locally, for the last couple of years. I think that's going to be impactful. I think funding those resources, if we not get funded, it's going to be, difficult as well. I think sustaining the programming, I think to me will be the most reasonable. I think continuing providing the families specifically that they are participating at this moment, I think we have seen the difference, the before and after, the positive impacts in the evaluations that we have seen individually and as a family. And I think to me, we completely understand, Alberto, that we going on the same boat. We understand the budget cuts as well, but I will tell you the truth, it will impact negatively the families who have actually participated in the programs in Longmont.
Okay, thank you. Any other questions from the board? Okay. If not, Jeffrey, do you have something?
Yeah, I was thinking about it. I think I will ask one question.
Go ahead. We still got a few minutes.
I think I read that you've changed your mission, and I know that's not an easy decision to make. And I wondered if you'd take just a moment and kind of explain what the purpose of the mission change and how that has redirected some of your programming.
Yes, thank you for the question. I think one of the reasons why we changed our mission was because when we were funded at the beginning of 2001, our mission was more focused on advocacy, specific for immigrants' rights around immigration reform, and driver's license for undocumented immigrants, workers' rights, anything legal aspects to support immigrants and protect their rights. And I think through those years, we were like really, struggling to get success and get somewhere. But at the same time, back in 2013, we realized that a lot of this stuff wasn't going to happen in overnight. But a lot of things were happening in our community that we were able to really address. So we did a community assessment back in 2013, and we realized that the needs, yes, were immigration, way workers, permits, you name it, all those protections. But the first thing that we saw was access to healthcare. Another thing was access to wellness, access to mental health. All those reasons that we said, man, we have to change our approach to really support for communities. We can make change locally by creating programs that will support communities and make changes locally. Immigration will happen. That was back in 2013. 2024 as well. Immigration is worse than ever. Immigration reform. I don't see that's going to happen. So the reason behind changing was to really adopt something that was going to include equity, access, and really education to our communities by creating programs that will support the quality of life for Latinos in Boulder County. And that was the reason. And it took us a year and a half to really realize changing, making the analysis, because we were well known about a really political activist organization in social justice. And we still are, but our approach is different because we address the real needs of our local communities, right? So we went through that process. Everybody adopted it. We were happy. It wasn't easy to really get to that mission, but also at the same time, we changed our logo, that represent more the community connection and stuff like this.
Well, I really appreciate, a service-oriented organization go back to the folks that they're serving and asking, what they need. So I think those assessments were really, powerful in sort of redirecting your organization. So kudos to you.
Thank you. Appreciate it. And that's technically, our priorities. Every year we try to understand and ask our community if anything is going on, anything had changed, so we can continue supporting and change and adapt to their needs.
All right. Any further questions from the board? If not, I'm going to give you your 5 minutes, Jorge and Wendy, and then we will be done.
Well, I just want to thank you for your time and by serving on this committee. I understand, I have been in your place and it takes a lot of time, and thank you just, by the effort to be here for a couple hours and maybe more that you're going to spend. And I appreciate all your support that you have done for the, organization in the community in Longmont.
Yeah, thank you. And definitely for, and understanding it and being part of it and being part of the change. That is a lot, says a lot. So we appreciate that. Thanks for being in this collective movement with us.
All right. Well, just to give you kind of what the next steps, okay, we're going to be doing hearings through the rest of October. We meet in November to do our deliberation hearings, and then I will be reaching out afterwards, and then what results of that, and then we take our recommendations to the City Council in December. City Council, of course, has the ability to change the recommendations. They typically don't, but they can. So I wanted to give that caveat. And I want to thank you for the work that you've been doing the last few years in Longmont. Appreciate your presence here, and have a great rest of your night.
Thank you, Alberto, and have a good night, everyone. Get some rest. Appreciate it. Thank you.
All right. And so, yes, Jeffrey, this is your first one. This is kind of how it goes. It's pretty fast paced, and it's amazing how fast 2 hours fly when you're asking tons of questions and having really good conversations. Any final thoughts before we end the meeting?
Thank you for keeping us on pace. That's a hard task.
Yeah.
I had a question. And I'm trying to figure out how to ask it without it being like so pointed. So some of the things that we heard today, like the groups, the applicant populations, will be heavily hit if the election goes one way or the other. Are our selections and this amount of money protected to go? Like, I know the City of Longmont can change it, but like, if there's some like larger issue, is this money protected to go to the?
This goes, yeah. So this has no federal. That's the wonderful thing about this. This is City of Longmont taxpayer dollars, no federal connections. We can fund what Again, this is why your role is so important, right? Your scores, your evaluation, our deliberation night. That is key, right? Because what you score is super important, and ultimately it's this year we added the subject matter experts as well, but even then you as board members still have more weights on your scores than I do and then the other staff do. So your scores are key. I mean, that's bottom line is, you're not the only decision makers, but you are definitely prioritized as far as decision makers, right? So yeah, there's no federal tie, so this is all City of Longmont taxpayer dollars.
I just wanted to check because I was like, oh my God.
Yeah, no, it's all all taxpayer dollars from the City of Longmont, and you guys are City of Longmont residents and you're members of the board, and we really appreciate the work that you do. I know it's a lot of reading, but we appreciate your work, and yeah, you have a big say in how these fundings go.
Gilberto, oh, sorry, Martha, go ahead.
Oh no, I just had a logistical question because like I was clicking along with the applications, but some of them look different. Like if they've applied before, it's like a side by side. Is there a way to make it look like it's just the one for this
They should
year?
all be side by sides. Now there's a way there's a way when you click on it, you can just see the application. Yeah. So if you're having issues, let's see if we can find the time to meet outside of a meeting to figure it out, because they should all be side by sides when you look at at the evaluation. But you can, but there is a button you can click that will take you just to only the application.
Okay.
I had a question about the software too. Alberto, is there a setting where it just totals your scores? I'm curious.
No, I do that. I do that myself. That's part of
Okay.
my hard work is I have to go and I take all of your scores and I input them and and then I get someone else to kind of quality check for me, and it's a lot of work. That's why I'm
Yeah.
asking for, like, by the end of October to have them as soon as you can have them, so it gives me time to do that checking and double checking, because it doesn't do it for us. I have to do all that work.
Okay.
Yeah. All right. Any other questions? All right. Thank you so much again for tonight for being here. I appreciate it, and have a great night. I'm gonna stop the recording.
Thanks.
See you later.
Too. Good night.